Hi, I'm Dr. Stephen Levine. Why include hearing testing in a medical practice? Because there is a need. 48 million Americans have at least a 25 decibel hearing loss. In 2011, researchers reported results of a sample of the general population tested by pure tone threshold audiogram in different age brackets. The testing was done between 2001 and 2008. And it, through its projections, asserts that 48 million Americans across all age groups suffer from hearing loss. This was reiterated in the September 2015 report from the President's Council of Advisors on Science and Technology in a manuscript called Aging America and Hearing Loss. Compared to the 20.6 million Americans who are experiencing visual loss, an effective base of 48 million hearing loss patients is sizable. When looking at age groups, 14% of those aged 45 to 64 had hearing loss, 33% of those aged 65 and older, and 67% of those aged 75 and older. Of the 48 million Americans with hearing loss, only 13% have been diagnosed. There are yet 42 million to be identified. There are two major causes of hearing loss that far exceed all others. Age-related hearing loss is probably today the most common cause of hearing loss, but it starts decades before first evident. Noise-induced hearing loss is the most rapidly growing cause of hearing loss, and the prevalence of noise-induced hearing loss is probably close to the prevalence of age-related hearing loss. Noise-induced hearing loss typically begins in the teens and early 20s. Age-related hearing loss and noise-induced hearing loss are additive with respect to their summation. Yet, only a fraction of those diagnosed wear hearing aids. This suggests that this is massive underdiagnosis and that there is a great role to be played in the general medical community. It is complicated by an increasing life expectancy and a growing younger population with unprecedented levels of noise-induced hearing loss, who ultimately will exhibit the cumulative effects of age-related and noise-induced hearing loss. It is difficult for patients to identify the disorder themselves. It's because it's usually slow and insidious, and consumers can take up to 10 years before they act on a hearing loss that they themselves have already noticed. Patients tend not to accept self-diagnostic pathways and applications, but they accept testing when recommended by a medical provider, and testing itself requires a special effort. Yes, there is an important role for primary care medicine in this diagnosis. Most patients with early detected age-related or noise-induced hearing loss can be counseled. For example, a youngster can be warned that listening to an MP3 player at high volumes over time can cause permanent damage to hearing. And for the commuter, exposure to noisy subway systems for just 15 minutes per day can cause permanent damage to hearing, again over time. As hearing loss becomes disabling, directed referrals become important. With shrinking available pools of specialists relative to the growth in the affected population, there is a need for identification of those affected with hearing loss. For those patients who present with an acute hearing problem, early diagnosis, referral, and treatment for acute sudden sensorineural hearing loss has far better outcome than late diagnosis and failed attempted treatment. And there is a role in specialty care medicine as well. Diabetics have a high incidence of hearing loss compared to the general population. Small vessel disease is a major cause of hearing loss and will be of interest to cardiology. Hearing testing is how one assesses the eighth cranial nerve and will be important to neurology, especially in patients with memory issues, since progressive hearing loss can affect memory issues in older patients. Patients undergoing chemotherapy are at risk for a hearing loss and fits the oncology bill. And then finally, ophthalmology sees patients all the time with at least one impaired sense organ. Adaptation when there are two impaired sense organs becomes all the more difficult, and all the more reason those patients need to be diagnosed. In summary, hearing testing is important to include in medical practices. Thank you.